training. They're just putting a list of everybody on that site. So that's one place to look. So improving quality. These are some of the different ways that the bill works to improve quality. Patient-centered primary care. Demos pay primary care providers fairly. Helping patients achieve independence at home. This is one very important area that they sought to see a change in relating to Medicaid. Because with Medicaid, you were tending to be sent to a Medicaid-approved facility primarily, and this is one of the things that they were really seeking to see a change in. Expanding and improving the healthcare workforce. There are some great provisions in this bill for students who receive medical training and serve underserved populations. So once their training is done, and then they go into underserved communities, rural areas, areas that don't have providers and work, can get loan forgiveness, can get grants, really great stuff in this bill. These are some of the patient protections we were talking about, eliminating pre-existing conditions, dependent children being covered on their parents' policy to age 26, and that's without restrictions, so they can be married, they don't have to be living with you, they're not required to be a student, and even if their employer offers coverage, they can still remain on the parents' policy until age 26. And coverage rescissions were limited to intentional abuse of coverage or fraud. Preventive care services at 100%. This was a big change. It was a big change whether it was Medicare or traditional coverage. For those receiving mammograms, that's a big area because of the expense related. Colonoscopies, that's another really high cost preventive care screening. And there are a number of high cost screenings that were included in the preventive care services that beforehand there would be, in many cases, a significant cost for, and that would be a barrier to accessing that important care. And so, under the Affordable Care Act, there is a significant list of preventive care services that are covered at 100%. So, we were talking about the rebate earlier, and that was the medical loss ratio rebate. And so how this applies is this. Carriers are required to devote a certain percentage of their premiums to provide healthcare services and activities to improve healthcare quality. In the individual and small group, they must spend 80%. In the large group, it's 85% of what they bring in must be spent to improve health care or on claims. And if they do not, then that's where they have to send out a rebate. And so that was the $53 rebate check that I think you mentioned. And so this past year, I know in Texas, many of the carriers actually were a little closer in pricing their products, and so because of that, there were very, very few rebate checks sent out. strange thing happen in Texas. The carriers did not like this provision because of the way it was written. And so in Texas, the carriers decided, well, we just won't sell child-only policies. We'll honor this provision as long as the child is on with a parent or with a family. We'll honor this provision. But we're not going to sell child-only policies. And the reasoning for this was they did not want to have a situation where there was a really, really sick child and employers were saying, why don't you go take that child and go get an individual policy for them? Because you're killing our rights. Because then, hey, that's reality. If you've got a little 10-man group and you've got an extremely sick child, you're looking at a dramatic increase in rates that next year. And so the carriers were like, we can't have this. So the majority of carriers in Texas just stopped selling child-only policies. And that's what we experienced here. In other states, they were selling them, but here they were not selling them. A goal of ACA was to reduce the number of uninsured women, and so one of the things that you'll see is that starting in 2014, individuals and families may be eligible for the subsidies like we were talking about. Also, limits will be placed on premium copay, deductible increases that are based exclusively on gender. So that's another thing where we're ending gender discrimination. Most insurance plans will cover pap smears, mammograms, birth control, osteoporosis screening, and immunizations at no additional cost to the member when they're preventive services. And so let me just stop there and caution everybody right there when we're talking about preventive services, because this is one gotcha that hits everybody. Anytime a person is having a preventive care, this is when I'm putting on my agent hat momentarily. Anytime a person is having a preventive screening and they find something, you know what happens? Anybody want to venture a guess? Audience participation? It's a magic word. Becomes diagnostic. Becomes diagnostic. Well, when it becomes diagnostic, what do you think happens? Well, it goes against your deductible and co-insurance. It doesn't get billed as a preventive, unfortunately. And that's one of the gotchas. Actually, if that has been brought up, I will tell you, the last time I was in Washington, I was told by several of the members I was visiting with, that's been brought up. It's one of the things that they were scratching their head going, you're kidding me. They're really doing that? They'll go in for a preventive, and then after they get that terrible news, they'll go hit them with a deductible. You're kidding me. They're working on it. They're working on it. And the health plans